What's up, everyone? Dr. Nate here with Catalyst Wellness and Physical Therapy. I'm here with Andrew,
Hey,
our marketing director. He's going to ask me some questions today about degenerative disc disease. Primarily, can you become paralyzed from it? This is actually a really high, just a question that a lot of people ask. And we're going to get down to the bottom of it today.
Yeah, so I'm a social media director here at Catalyst, and I actually got diagnosed with DDD, for short, degenerative disc disease, about a year ago.
I didn't know that.
Yeah.
Really?
Yeah.
They actually gave you that diagnosis?
They did give me that diagnosis.
Okay.
So it's called DDD.
Triple D.
And I guess like some questions that I still have.
Yeah, no, I didn't. This is good. I didn't know this.
Yeah.
Okay. Yeah.
So I guess kind of like that in itself, like for those people watching right now and they have been told what DDD is, why don't we do like a quick little brief intro? Like, what is DDD from a doctor's standpoint?
Yeah, so degenerative disc disease, DDD, is essentially a loss of disc height between your spine. So you have your the body of the spine itself, and then in between each of those, so like a lot of people know what like L4, L5 is, right?
Yeah.
So there's a disc that is between L4 and L5. And as we get older, that disc starts to get a little less hydrated and it starts to shrink a bit. And it can get to a point where there is no more disc, or the disc is very thin and less less shock absorbent, if you will. So it's called degenerative because it essentially happens over time and all that type of stuff. And they call it a disease, but I don't know, like the way that it's been described, I think this is actually a really good way it's described, is it's kind of like wrinkles on the inside in the sense of nobody calls having wrinkles a disease.
Yeah. Right?
I mean, we shouldn't. That wouldn't be very kind. So that'd be terrible. So it's not a disease. I don't like the term degenerative disc disease.
Yeah.
Now, are they degenerating or decreasing in height? Sure. Like it happens.
Happening in everybody.
It happens in everybody, right? And I think that's an important thing to note, is that degenerative disc disease this decrease in disc height and this decrease in hydration, it happens. And as you get older, the percentage of people that it's apparent in from an x-ray gets even higher, right? So just to give you an example, I need to look at the stats again, but I have this infographic that I show a lot of people, and I believe it shows that if you are 70 years old, like 85% of people or 90% of people from that study had degenerative disc disease, but they had no symptoms, like they had no back pain.
Yeah.
So it's important, again, like we have talked about before, that even if you are diagnosed with that and you have back pain, it's likely that was there before you were diagnosed with the back pain, because that's a long process, right? It takes a long time for disc height to decrease. So it's unlikely that it just hit a tipping point and then you had pain. It's likely something related to a movement that you did. Maybe you started a new job where you're sitting a lot and you're not used to that. Maybe you have a new job where you're standing a lot and you're not used to that.
Yeah.
Maybe you just went for a really long hike and all of a sudden it just hurt. I think you were doing like gymnastics, right? Like you were doing like some pretty high impact stuff.
Yeah, for me,
right?
they didn't know specifically, because like it's such a tough disease, at least from my understanding, meeting with like orthopedic specialists and people who were like kind of trying to diagnose me with DDD. They were like, well, you do a lot of this stuff. I had one traumatic episode where like I did have a fracture in one of my spinous processes. So like it's like there's like little like bumps basically on your spine, and one of them cracked a little bit. Not a full crack, but it was a little partial crack.
And this was an extension injury, right?
I was actually stretching from the library. So after studying in the night, studying at the library all night, I went into like a little back extension, and I guess I pushed myself a little too far.
I thought it happened from a surfing incident.
No. Yeah.
I didn't know that.
Yeah, happened from extending And then next thing you know, I came down to the ground and was like, oh my gosh, I can't like move my legs.
So you fractured it.
So I actually fractured it.
Holy moly.
And then I went back into like urgent care. So the next day I couldn't move. The following day I went to urgent care. And basically they were like, oh, like you're young, you're fine. But I'm just like, yeah, no, something happened.
Can we pause on that really quick?
Yeah.
So if you're young and your doctor's not listening to you, go to somewhere new, because just because you're young doesn't mean that you can't have orthopedic issues, right? Like it's not, it's kind of the same thing that happens with women too. Like for a long time, physicians will just kind of write off, oh, you're fine. You're just, you're whatever, going through menopause or something.
They
like
offered me opiates, and I was like, no.
Yeah, so it's not like for women and for younger people, and then also for older people, right? There's like you just kind of get written off. So just make sure that your physician is really listening to you, doing a really good clinical exam. Just because you're young doesn't mean you can't have back pain or some other type of issue.
Yeah, I definitely agree with that. I think what's really important too is doing your research beforehand, not on the specific topic, but doing your research on who you're seeing, because it definitely does like kind of factor into like your rehab process. Like if you go to a doctor who's been practicing for like maybe 70 years, like maybe he might be a little bit out of date, or even like maybe there's just better people. There's always new, well-educated people that can kind of help you the way you want to be helped, based off like what specifically you're dealing with. So for me, I reached out to like Instagram, and then finally I had a friend that had a very similar condition with me. So I have like spondylolisthesis, which is the fracture, and it's very common in gymnastics and tennis players. And my friend was a tennis player, and she's like, oh my gosh, like you have to go to my doctor. Like he helped me out because she had a worse process than me. She went to doctor after doctor after doctor saying, you're going to need surgery, you're going to need surgery, you're going to need surgery. And eventually she went to him, and he's like, you're fine. You're 14. You don't need surgery. And now she's the same age as me, 25. She's fine. She's like, I'm so glad I went with him because every other doctor said I needed surgery. So definitely.
Do you know what grade your spondy was? Spondylolisthesis?
They found out when I had my DDD. Okay. So they found out my spondylolisthesis when I had my when I had my degenerative disc disease, or my little episode spondylolisthesis.
Because there's 4 grades. There's grade 1, 2, 3, and 4.
I thought you meant like kind of like age grade.
No. Yeah.
I had grade 2.
Okay. Yeah. So that conservative management usually.
Definitely conservative.
If it was like grade, so there's different grades of spondylolisthesis, and that's essentially the vertebrae is starting to move backwards on the supporting vertebrae. So you can have like L5 starts to drift back. And so now this instead of being stacked on top of each other, they're kind of like like this. They're kind of like angled. And if it was like a grade 4 and you're having like numbness, tingling, weakness, that type of stuff, then that might require a surgical procedure. But a grade 1 and 2 can generally be treated non-operatively.
Even 3 too.
And 3, yeah. As long as you don't have neurological symptoms, right? What I'm curious, what did you think what was the first thing you thought of because I remember when you first came in, you were having some back issues.
Yeah, I couldn't lift.
You couldn't lift. I know you're cleaning a lot of tables at work, and that seemed to have kind of even brought it on.
It agitated it
again. Yeah.
And I realized that I wasn't watching my form. And I think I wasn't necessarily doing any physical therapy. So when I had my condition, I'm a physical therapy aide as well. And I was like, you know what, I can do my own exercise program. I can look up things online and figure my own. But the thing is, like, you need to be dedicated to it. And a good way for people to become dedicated is spending money. If they spend money to go do something, they're not going to like not go do it. So for me, For the most part, exactly. Yeah. So I was like, all right, you know what? My back isn't getting better. I was working and all of a sudden had a little spasm and it kind of like freaked me out. And I'm like, all right, like I need to go to physical therapy and actually have somebody do it. So went to a third party and went to Monterey Spine and Joint and went to physical therapy there and fixed me right up. Literally was like, I would come in with pain and leave without. Like, it was crazy. Like, my chronic pain for like a year, not doing anything, was gone. But I think that's indicative of like, hey, like, that's a clue, like we were talking about. Like, you need to do something. Like, sitting around at the house isn't going to do something. Like, by then, I would say, like, it's a little like excessive to think this way. But in a way, if you sit down and do nothing, you basically in itself are paralyzing yourself. Like, the disease isn't going to paralyze you. You're going to paralyze yourself if you don't do anything.
Yeah, and so just I guess the question at hand is, can it paralyze you? I think people think of like, if you had the degenerative disc disease, or you have that degeneration over time, can it get so bad that it like compresses the nerve roots and all that type of stuff? And the reality is probably not. I personally haven't met anybody who's become like wheelchair bound from the disc height narrow, or the disc space narrowing. Has it happened? Maybe, but I mean, there's lots of things that happen 1 in a million, you know. People get struck by lightning. So, you know, that type of stuff happens, but it's not something I would even concern yourself with. Stenosis is more challenging, but we can make another video about that. But yeah, I don't think that being paralyzed is something that is realistic of happening. But but what you're saying, definitely people who just stop moving and doing things. I mean, you can lose a lot of muscle mass if you are just stopping exercising and moving for several months, right? Like, that's a lot of muscle mass lost. Yeah. So that's why it's important, especially as you get older too. Like, people who are 60, 70, 80, you stop moving for 2 months. I mean, that's a sharp decline. I mean, you lose muscle mass so much faster as you get older too. Yeah. So if for no other reason than to just preserve your muscle mass and your skeletal structure, staying moving is the best option.
I guess, long story short, will you be paralyzed with DDD?
No.
That is it.
No.
All right. Thank you guys for coming in. And I guess we will talk to you about a new topic on our next video.
Is this on YouTube?
Yes. This is on YouTube.
So please like this video, subscribe to the channel, and write a comment below if you have DDD and what you've done about it. And I will see you in the next video.